Thank you, everyone. Tom, thank you. What a organization, best in class. Cypress is. Definitely thank all the team members here from Cypress. They're doing an excellent job. We really appreciate to be a part of this, especially for the second year. The number one thing I hear is this is too good to be true about my product. We're a solutions company. We've been around for 6 years. We have some customers that include the NFL, Coca-Cola, McDonald's. So we have some named customers. We have 1,000 self-insured plans that are using our products. But the number one thing I get is, are you going to try to sell me a timeshare when I go on one of these trips? We don't sell timeshares, okay? If I'm doing my job really well, some of your members in your organizations will take vacations 2 to 3 times a year, excuse me. A week, that'd be great. And they get to go to the Grand Cayman Islands. Going back, we're a solutions company. We focus on the high cost spend on your balance sheet, reducing that. So instead of trying to save a nickel on every Band-Aid and you use 100,000 Band-Aids, we look at the highest cost predictable events, meaning I can wreck my motorcycle and I get rushed to the nearest hospital. That's not predictable. No one's gonna know where I'm gonna wreck my motorcycle or which hospital I'm gonna go to or what that bill's gonna be. If my hip goes out for years of playing sports and I get to pick a location, that's predictable. I don't want to go to a regional hospital. I don't want to go to a hospital to have my hip done. The reason why is at hospitals, that's where infections live. When someone's sick, they don't go to an outpatient surgery center. They go to a hospital. When someone has an infection in their hand, like MRSA, they go to a hospital. That surgeon does not want you at his outpatient surgery center if you have an infection. Infection rates are double-digit higher at hospitals. Okay? Also, there's subspecialties for orthopedic surgeons, which we do 400 bundled procedures. We have 1,400 centers throughout the United States. We're in 46 states. We're not in Hawaii, Alaska, North Dakota, and Maine. Everywhere else, we have a lot of centers. Typical drive time is 15 to 20 minutes. There's exceptions there. If you live in Southwest Kansas, where I used to farm when I was a kid, there's nothing there. Okay? Those people are used to driving. They're going to drive. If you're in a major metropolitan area like Dallas, we got 12 centers you can drive to. Okay? You can pick from hundreds of surgeons that you can have a surgery done. Let me go on. So again, we're a solutions company. We have 2 main solutions. We have a surgical solution where we're focusing on 400 bundled procedures. Also, our pricing is typically 50% lower than the BUCA rates. Blue Cross, United, Cigna, Aetna, if someone doesn't know what BUCA means. So we're 50% lower than their reimbursement rate, not the billed rate. Okay, so we're doing total hips, total knees, all in on the bundle for $20,000, including the hardware, the facility fee, the DME, the lab work. All of that's included. All the professional fees, the anesthesiologists, the nurses, the surgeons, all in. Okay, and the care is better. We have some doctors in our system like Dr. Michael Kaplan, the ESPN analyst if you watch NFL football. He's also a teaching professor at Yale. He does total hips and total knees for $20,000. If you go to a hospital, it's $80,000. So that's the advantage of doing this. I'm going to show you some real cases here real quick. This is a plan, and we call it ABC Company just so we don't have the name. These are the number of cases. Understand, we're only touching 3 to 5% of the population when we're looking at surgeries. So we also do surgery or procedures like colonoscopies. That's our most common procedure. So if you look at this is an average size company. They have 29 pending cases. 143 member inquiries. We have nurse navigators that they reach out to. You guys heard a one call yesterday with Ray, did an excellent job. We are the surgery equivalent of one call for MRIs or imaging or ultrasounds. That's what we do. So when you have an issue, you call an 800 number, just like one call. Ray did an excellent job. He's a great partner of ours. We work with his organization. We work with a lot of the vendors around here, including the FIA group, and a lot of the stop loss out here as well. And this gets added to the program. There's some language changes, but it's very simple. And what we focus on is when a member needs a surgery or procedure, call this number. You'll save a considerable amount of money. Something else to know, why would the members do this? The members do this because there's no copays or deductibles. Sometimes they're even compensated to go to a better place. Okay, so think about this. You need surgery, you need a meniscus repair. It's gonna cost $12,000 at a hospital. We do meniscus repair sub $4,000. If you have to reach in your pocket and pay $2,500 to a surgery, or you can call this number and they can give you 12 locations to go to and hundreds of doctors that are all qualified, and some of them are the same doctors, not always. Some doctors only practice at certain hospitals. You have no copay, no deductible, you get a lower price, and you're getting better care. PriceMDs, and not to pat ourselves on the back, we won the Abby Award for the Diamond for improving healthcare outcomes while lowering the cost. It's a 20-year award. We won it a year and a half ago. Steve Case of AOL gave out the award. This is the following year. The number of people who use our program increased after the second year. So this is the same company. You can see they have more, it's earlier in the year, but more pending cases, 152 member inquiries, and 46. And so what typically happens is, and I'll go to the next one, you can see a breakdown. We give you runs on how it's working. So you can see on this list the procedures we're doing. We're doing spinal fusions. We're doing colonoscopies, like I said, meniscus repairs. It's all on this list. And you can see the savings of what you would have paid, and we can compare that to any rates. This is my transition point. So now I'm going to talk about something that's really exciting. Is we're doing international medical tourism for drugs. Okay, this is a voluntary program. You can't mandate this. You can't say you absolutely have to go to the Cayman Islands and have an awesome vacation. But you can offer this up, and we save money on medications by a minimum of about 30%, up to 50% on drugs. Again, there's no copay and deductible for this. So if someone's on Humira, Enbrel, Stelara, the biologics, we can source that drug international. They take 2 or 3 trips a year down to the Grand Cayman Islands, and they pick up their medication there. It's all done through a nurse navigator. Also, there's no additional work for HR on this. There's no additional work for the TPA on this, for the broker, for anybody. We all do it internal. We do have some plan language changes. There's also no expense for this program. If you add this and you use it and you save money, great. If you never use it again, that's great. We have a 100% re-up rate for the people taking the second trip. They love to use it. On this list, you see we have yellow, blue, and green. The yellow list are the drugs that we're saving roughly per trip between $7,000, $10,000, $20,000 per trip. The blue drugs, you're talking $50,000 plus per trip in savings, up to $250,000 a trip. So imagine you have a member with a high cost spend, someone who has cystic fibrosis, MS, they have a blood disorder, hemophilia. Those type of drugs, if they're on these, we send them down there, they get treated down there. They come back with medication for 3, 4, 5 months, and then they repeat that process. And every time they go, your plan or your group or your organization saves $100,000, $200,000. It's not a bad deal. This is a real customer as well. So this is what we need from you if you are interested in this program. All we need is the drug name, we need the dosing, and what you guys pay. Drug name, dosing, what you pay. I don't want any PHI, I don't need to know people's names. If you provide that, we will price it to the penny of what we can save you. If it works, you hire PriceMDs. We'll go to work, we'll save you the money, we'll show you how it works. There is a little, like I like to call sausage making in this process that we do. Working with people like the FIA Group, there's legal, we have some legal language. This program was vetted by Greenberg Traurig, the largest law firm in the United States. The 2 lawyers we used were Eric Hargan and Bob Chirot. Eric Hargan does not work for us anymore because he's undersecretary in the Bush administration, and Robert Chirot is general counsel. The reason why I say that is HHS regulates the self-importation of drugs. So if I leave the country and I want to buy medication and bring it back, I have to follow a certain protocol. One of it is I have to be treated. So I have to go down there and I do have to see a doctor. We are also not separating the relationship with the patient with their current provider in the US. We do not want that to happen. They have to be on board. They're going down there, they're getting a secondary opinion, and they're getting treatment. We also are not doing virgin dosing. If I suddenly go to my dermatologist because I have psoriasis, and my dermatologist says, Dante, we're going to put you on Humira, my first dose is not going to be on this program. We do not want to risk your members having an incident while they're traveling international that they're going to have a reaction to the medication. These are all chronic disease states, so these people are on it. But we're doing drugs. If you watch TV, all the drugs you see on TV are $4,500 or more. Those are like Ibrance, Humira, Enbrel, Stelara. You see a drug for everything right now. The other thing that's really scary for everybody in the room, or for healthcare in general, there's 20 drugs in stage 4 clinical trials that they've changed the formulary status of it from going from a 50,000 or less drug to a year to a 400,000 or more. And what that means is they're putting a pill into a gel. They're making an injectable out of it. It's the same formulation. Patent extends, doctors prescribe it, and now you have a $400,000 bill instead of a $50,000 bill per year. The other thing is the majority of the members on these programs do not realize what the drugs cost. They're not cognizant of it. They're like, oh, my drug costs that. They think their drug costs their copay. You know, they're oblivious to it. This is a way you can get real savings, and the lowest savings we get on any drug is $25,000 a year. So if you just get one member to use this for 1 year, you save $25,000. It's not a bad deal. We have some members on these drugs that are saving their plan $2 million a year for one person to go down there 3 times a year. Not a bad deal. So what you're seeing here is after I get your drug name, after I get your dosing and your spend, we will price it out to the penny of what you'll save using this program. Our fees and expenses and everything are built in. We like to compare this apples to apples. Again, we do not replace relationships. We're not trying to be your PBM. We touch less than 1% of your population. I can't be your PBM. Also, if I have a wedding next week and I'm on Humira and I can't go because it's my trip time, I need my PBM like Magellan to fill that script for me here on these specialty drugs. I can't separate that relationship, okay? Members sometimes can't go either because they have other comorbidities and their health declines. We do have nurses that handle all intake on this. They ask them a lot of questions. We are not going to have an international incident where someone goes and they have some incident. We do have people who've gone down in a wheelchair. We've had a billionaire go down who's the CEO of his company. We've had someone who's never flown on a plane before go with his wife who's never went on a honeymoon. They were married for 30 years and they went on this program. It's a fantastic program. It does work and it works well for everyone and everybody has a great trip. Something else to note, once we get sausage making done and we've changed the language and everybody's approved everything on the drugs that we're going to do and a nurse reaches out to the member and the doctor agrees to everything and everything's done, the member gets booked like it's a travel to a foreign destination. They're met at the door of the plane. The place they go is the Grand Cayman Islands. They are met at the door of the plane. They skip regular customs. They get their luggage loaded in a town car or a limousine. If they don't have any other comorbidities, they have alcohol. They're drinking alcohol before they go to their hotel on 7 Mile Beach. This is where I get this sounds too good to be true. When they get to the hotel and they check in, they get an envelope full of cash for incidentals. Okay? The whole time is theirs while they're there. They're also handed a cell phone. On the cell phone is their driver's number, their concierge number, and their nurse number. They could also use that number if they want to call back and they don't want to spend their own dollars on international calls. Within that, they only have to go to one appointment where they see a treatment for a treating doctor. We have a relationship with the Grand Cayman Island government, with the former health minister. His wife is currently the Secretary of the Treasury there, signs the money. We also have a relationship with Dr. Kona, who's the doctor of the island, who has a government position. He's also a U.S. citizen. He has a son. He's been there 20 years, but he's a U.S. doctor. He has a son that flies pilot on one of the U.S. aircraft carriers. Excellent bedside manner. And then we deal with a very wealthy individual that owns the majority of the hotels on the island. So you can see the relationship. We're the only company that does this. Here's another run. We deal with unions as well. This is one, they had a $19 million spend. With our pricing, we can get down to 12. We'll save them $7 million a year. This is an actual company that we're doing this for. This is not right for everybody though. Just understand, we do have a 70% uptake rate of the people who are eligible to do this, okay? 70% of the people say yes when we ask them, a nurse asks them if they want to do this. The biggest no is, I've never been on a flight, I've never left the country, I don't have a passport. We will give you a proposal. If you would like us to quote any groups for you or your own company itself, we'll give you a proposal to the penny of what it costs with our fees and everything built in. And then if you see in the yellow, this is a medium-sized plan that came to us. We do our pricing versus their pricing, apples to apples. So you know that, hey, if you're paying Humira pens for 2 pens, $5,200 here, you're gonna only pay with us, say, $2,500, and we're gonna give you 3 or 4 months worth. Here's the uniqueness of the plan. There's no cost to this plan. If you wanna just try it, there's no sign up, there's no annual, there's no PEPM. If this makes sense for you and you wanna do it, we have 1,000 customers that use this. Okay, so this isn't a new thing, people are doing this. It is approved. We've never had any issues with bringing drugs back into the United States. I know the FIA group brought up. There are some mail order type companies that do have issues with that. This program does not have any issues with that. We guarantee it. that you'll never have any issue. And again, we have a 100% re-up rate for people that try this program once. And again, the lowest savings we do, if we only get one of your members to go, we'll save you $25,000 for the year. So that's what we do. So does anybody have any questions? I got a lot of time.
I'd just like to give you an endorsement. A year ago, about a month before we came to Cypress University, we had a new member come on the plan, and we got our pharmacy statement, and there was a prescription for Stelara. Yeah. And we looked at that and said, holy crap, this is going to have a very negative effect on our plan. Came to Cypress University, heard your presentation last year, sidebarred with you guys. We fast-tracked the plan changes, the documentation, and we got this, it's an employee with like a 19-year-old daughter. Okay. Yeah. Got him, his wife, and his daughter to the Caymans. They just came back from their third trip, saving us about $100,000 a year, and they absolutely love their little vacation to the Cayman every 4 months, so it really works.
Thank you very much. I appreciate that. If I give you one analogy of what this program's like, it's a venue change. So I live in Tampa Bay. We have a sort of crappy football team called the Buccaneers. When I go to Buccaneers game and I buy a Budweiser, it's $12, okay, when I'm in the Buccaneer Stadium. When I leave there and I go to 7-Eleven and I buy a Budweiser because we lost so bad, it's $2. Is Budweiser happy to sell me both beers? Yeah, because it costs them 30 cents. Okay, they're happy. Would they rather sell all $12 bills? Of course. Venue change. It's arbitrage. Okay, I came from finance. We're always looking for arbitrage. The point is the United States is Buccaneer Stadium. The rest of the world is 7-Eleven. Okay? I know I probably sound like Trump now, but the point is that's all we're doing. These are the same exact drugs. We're buying from U.S. manufacturers. We're just buying outside the U.S. I'm going to give you another fact that's crazy. The majority of the hemophilia drugs, like Advate, Adenovate, Novo7, are made by one company. There's 400,000 hemophiliacs in the world, worldwide. 20,000 of them roughly reside in the U.S. The main company that makes that makes more money on the 20,000 by double than the 380,000 outside the U.S. Okay? If you know the pricing difference. So is that crazy? I don't want to say it's wrong, but this is just something that you're able to do. If it works for your members, it's a great win. Again, if you guys have any questions, my booth's right over here. We'd love to talk to you. Dr. Grossman, who's the founder of the company, who's a retired surgeon and hospital owner, is also there with me. Please let me know. Come over to us. We'd love to help you guys out if there's something we can do.
You have another question?
Sure.
And while Greg's looking, I didn't know that we had a lot in common, but I'm a fan of a crappy football team too. They're called the Buffalo Bills.
There you go.
So,
there you go.
Well, it all works out okay.
I've got 2 questions.
Sure.
Does the program work for infusions?
Yes,
And,
absolutely.
okay. My other question is, how are you compensated? Because you're not doing this for free, I'm assuming.
Yeah, no, we're not a charity. So we build in, so here's the issue. So we're trying to match apples to apples. And so our core product, our flagship product is the surgery product. And that's what we've been doing for over 6 years. So we realized we had to show apples to apples when we price this. Also, a lot of our 911 calls come from stop loss. So we build in a fee of the total package. So prices for, say, like a hotel room in the Grand Cayman Islands vary greatly. So when high season, it's $1,200 a night. Low season, it's $250 a night. We build in a flat fee with what we make in profit margin to compare apples to apples when we quote you. So we figure out roughly, hopefully you guys go for all 3 years. If you go to high season, we make less. If you go low season vice, we make more. So that's built into the net price. So if I quote you, for instance, Humira, and you're getting 15 pens, your price is $32,000, our price is $19,000. You guys can then look at it as a PBM run, as a pure, simple, this is what it costs. And it's also easier for payments and so forth, and you don't have to get into any of the sausage making of, hey, how much did the trip cost? How much did the car service cost? What did they pay for dinner? How much money did they get? That's all included in that, and our fees are built in there, as well as paying our partners down on the island. Good question, though. Thank you.
Who else has a question? I can tell you that we had a patient last year who was a Harvoni patient. and went to the Cayman Islands. And I think Harvoni in the States would cost, that treatment would be what?
It used to be 105. It's come way, way down. Harvoni, we actually don't even do anymore because it's declined so much,
Yeah.
but it's a 90-day oral pill. It treats genotype 1. It was 105 for 90 days. Down there, it's 12,000.
Yeah,
That's the biggest discrepancy.
I think we had, I think our client ended up paying $17,000.
Okay, yeah. 'Cause
Yeah.
if you add more stuff, more people, more things, it goes up. Yeah.
Right. And appreciate the endorsement for both his program and the Cypress U. But that's what the point of what we're doing here, and I'm glad to hear that somebody actually took advantage of the information that they learned here last year. So that's great.